Hi everyone, good afternoon. It is close to the end of day, but we're getting in one last treatment, and that's TruSculpt. So we're going to be treating the arms. This is an area that is a big concern for a lot of men and women. There's two components here. Fat that we don't want on the lower posterior aspect of the arm, but then also skin tightening. A lot of times we start to notice that if we had just been able to pick up the skin, the overall area would look a little bit better. So with TruSculpt, we can reduce some of the fat as well as tighten the skin. We're going to then combine this with another treatment for skin tightening that's needled heat, and we'll do the second one after we do TruSculpt. So it's a 15-minute treatment, and we're first going to just target this one area. So what I like to do, and I've already applied this little sticker, it's going to hold these little paddles onto the skin, and it's going to protect the skin. What we do is deliver heat for 15 minutes, and over the course of time, we increase the heat in the area until we've hit our goal temperature. That's where we know we are going to start breaking down those fat cells and tightening skin. So I'm just going to apply this to her arm. 2 in the back, 2 in the front. I call it the sandwich technique, where you really just get to target that area that's problematic for a lot of patients.
So after this treatment, is there anything that you should or should not be doing?
Great question. So actually what you can do is work out, and I would say just want to avoid very high heat. So maybe not the sauna, but you can definitely work out, which is great because a lot of treatments actually limit you. Patients are very religious about their fitness routines. So I would just avoid high heat because sometimes the skin is a little bit more sensitive. But other than that, there's really nothing that you do or don't do. Nothing's really going to make it or break it other than being consistent with treatment. So now that the area is wrapped, do you feel like anything's pinching you?
No.
I'm going to give you your armrest back. And you can now go ahead and put that back. You can lay back and relax. And we're going to start the timer. So there's nothing that's going to hinder the treatment. The best thing that you could do is keep working out, keep eating well, drink a lot of water, and just kind of stay focused on the goal. But over the course of 12 to 16 weeks, you'll see that full cycle of breaking down the fat cells, seeing the skin tightening. So I'm going to lower because the arms are a little bit more sensitive. When I press start, 2 of your 4 applicators are going to feel warm, and then we'll increase from there, okay? Of course. We missed one step here. Guys, this is the most important thing, and I totally forgot about it. Sit forward for me for 1 second. Grounding pads. So, not all radiofrequency has a grounding pad. And as soon as I connect this, we'll be ready to go. Why are grounding pads important? Because they take all of the energy and allow it to stay focused, go ahead and lay back, on the area that we are targeting. So what it's going to do is make sure that the radio frequency stays focused on her arm and doesn't float freely throughout the body. RF is very common now, great for skin tightening, great for reducing the fat in an area, and it can be internal and external. We always do things like Renuvion in the operating room. This is using that same method of heat to stimulate collagen, push it deep into the dermis, but without breaking the skin and targeting all of our concerns. So I'm going to re-enter some demographics. As soon as it's warmed up, we'll turn it back on. Now with TruSculpt, we're right now only doing 4 applicators. For some patients, we're doing all 6 at a time. We're using 4 per side right now, so we're breaking this into 2 different treatments. And they are going to toggle between 1 and 2 heating and 3 and 4. Here's the heat, I'm going to lower it first. So it just started, and right now 2 of them are on. We're going to increase the heat, and as the treatment goes through, it'll cycle between being on and being off. 1 and 2 will turn on, 3 and 4 will turn on. So it's going to steadily and safely increase the temperature. She'll be comfortable, and if it's ever a little bit too much, we'll pause it or go slower. So we've started our treatment, and there's not really anything to see from that point on. We're just going to increase the temp and wait it out. So we'll tune back in for the next step. We're going to do Morpheus 8, but that's it for now. Do you guys have any questions?
How long does this take?
15 15 minutes.
15 minutes per treatment.
Plus setup. A little extra if you forgot the grounding pads.
Great.
Did you have a question too?
I think that I heard that the liver is what metabolizes the fat or something. Is that right?
Yeah, so that is true. When you break down the fat cells, it's called apoptosis. Fat cells die off. They get circulated, filtered, and excreted in the urine. So you'll actually have some circulation. The kidneys will pass it out in the end, but it will kind of go through that whole process.
So does drinking affect it, the treatment itself?
I don't know if it would. I wouldn't hold back. I mean, by all means, enjoy. But I don't think it'll hinder you. I don't think so at all. Just increasing your water intake is always recommended. Okay, but that would be it. I'm gonna go up a little bit if you're comfortable. Yeah.
What's the longest time a session can take?
It's not based on the actual treatment. It's how many areas we do. So I will tell you, I have some patients who come in and they're with me for 4 hours because 4 hours because we are doing arms, like bra roll, which is a big area of concern, the flanks, the abdomen, inner thigh, outer thigh. I mean, it's so customizable that like people come in and they're like, well, this is a problem, this is a problem. So if we're doing multiple areas like that, I mean, you could be in here for a while. But in general, per 6 applicators is 15 minutes. So give or take the changing of pads and replacing it, like the supplies, it's pretty quick. Yours will be about 40 minutes total. Not too bad.
Is that including the Morpheus?
Not including Morpheus. We'll have to numb because it does hurt a little bit.
Okay.
And then that'll be probably 25, 20, 30 minutes.
Okay.
Yeah. All right, guys. So we're going to finish up. If you have questions, you let me know about